Hello, student doctors. Tuning on with my pulmonary lecture, Drugs to Treat Influenza. I'll talk about Baloxavir and Amantadine. You can click on the link, full prescribing information. There's a picture of the structure of Baloxavir, also called Xofluza. This drug was only recently approved in 2018. Mechanism of action of this drug, polymerase acidic endonuclease inhibitor. This drug inhibits virus mRNA replication, inhibiting transcription. This drug is for patients 12 years of age and older who've been symptomatic for no more than 2 days. Adverse effects, warnings and precautions, and drug interactions. We need to avoid co-administration antacids or oral supplements, calcium, iron, magnesium, selenium, or zinc. There are no black box warnings associated with this drug. Baloxavir is a prodrug. UGT1A3 and CYP3A4 are the major metabolic pathways. Here's the structure of amantadine and a label. Antiviral drug, which also acts as an anti-Parkinson's agent, for which it's usually combined with L-DOPA when L-DOPA responses decline. As an antiviral, amantadine interferes with the function of the transmembrane domain of the viral M2 protein. It can prevent virus assembly during virus replication and does not appear to interfere with the immunogenicity of inactivated influenza A virus vaccine. This drug is indicated prophylaxis and treatment of signs and symptoms influenza A virus. There's some fairly serious adverse effects: suicidality, depression, hallucinations, psychotic behavior. Abrupt withdrawal can precipitate emergent hyperpyrexia and confusion, lack of impulse control, and other compulsive behavior. There's some pretty serious warnings and precautions, including death. There's overdose attempts with amantadine. The lowest reported acute lethal dose was as little as 1 gram. Acute toxicity attributable to the anticholinergic-like side effects of amantadine. Produces cardiac, respiratory, renal, or CNS system toxicity. Cardiac dysfunctions to include arrhythmia, tachycardia, and hypertension. This drug can actually exacerbate mental problems in patients with a history of psychiatric disorders. This drug can precipitate seizures, CNS effects. Now, amantadine itself has no direct anticholinergic action. However, its anticholinergic-like side effects may cause somnolence, mydriasis, so it shouldn't be given to patients with untreated angle closure glaucoma. This drug should not be discontinued abruptly in patients with Parkinson's disease, delirium, agitation, delusions, hallucinations. Patients with kidney disease and liver disease, appropriate care should be taken in patients with these. Surprisingly, there are no black box warnings associated. The mean half-life of amantadine ranges from 10 to 14 hours. Renal impairment causes a severe increase in half-life to 7 to 10 days. So you have to be very careful in patients with renal disease. Okay, student doctors, that's it for Baloxavir and amantadine. Carry on.